Hi, so today we're going to be going over how to side different bones from one from the axial skeleton and all the rest from the appendicular skeleton because I know that can be kind of a tricky aspect of knowing if it's left or right. So we're going to go over some of the anatomical terms for each bone and hopefully that'll help you decide which is left or right. So the first bone that we're going to go over is the only one in the axial skeleton that you're going to need to know how to side, and that's going to be the ribs. So with the ribs, you have three distinguishing features that are going to help you know whether it's left or right. So the first one is going to be the sternal end, which is this really flat end right here, almost perfectly flat actually. And as you can imagine, based on the name, sternal end, it's going to be articulating with the sternum. So if you look at this model right here, you can notice that this flat end right here is actually going to be articulating with the cartilage of the sternum. And so that's always going to be on your anterior side. So this very flat end is always going to be on the anterior side. So if you look at the other end, which is called the head, it's significantly more rough. There's no uniform nature to it, unlike the sternal end, which is perfectly flat. So now you at least know which part is going to be facing forward and which part is going to be more towards your spine. And so now you need to figure out if it's actually up or down, so that way you know if it's left or right. And so part of the body of the rib is called the angle, and it's this part right here. So if you notice that it's actually pretty uniform in height right here, and then it kind of dips down. So that dip right there is called the angle, and that's actually going to be one of the most defining features to determine if it's left or right. So with a lot of features in the body, when you have kind of a sharp, prominent aspect to it, or even a very rough side to it, that's generally going to be pointed down or away from you. And so the rib is no exception to that. So if you look, this part that's sticking out right here, that's going to be pointed down. So that way now you know, with the sternal end being on the anterior side, and with the angle pointing down, you know that this is a left rib. Okay, so now we're going to go over the scapula, which is, many of you probably know, it's also called the shoulder blade. So this is actually one of the easier bones to side. There's not really too much to it that you need to know. There's really only two features actually that you need to know, that being the glenoid fossa right here, and the spine, which is again a sharp and prominent aspect that's coming out of it. So like I said before, whenever you have something like that, it's usually going to either be pointing down or away from you. And so this, as you can imagine, is going to be pointed away from you. And with this fossa right here, this dip, that's actually going to be the point where your humerus, which is your arm right here, that's where it's going to be articulating into your shoulder blade. And so as you can imagine, you have a humerus that just comes in and articulates right there. And so this is actually going to be a left scapula because you want this to be pointed obviously more laterally because that's where your arm is going to be. And then, like I said, you want to have the spine pointed away from you. So that'll be a left scapula. Start that over. Okay, so now we're going to go over the clavicle, which is also called the collarbone. And this one actually is also pretty easy to side. It's not too bad. And so kind of like the rib, you're going to have three defining features to this. One is the acromial end, which, if you can see, is a very flat end. It kind of comes from the thicker part of the body and then it thins out. And that's just kind of lying on the surface going onto your scapula. And so this end right here is called the sternal end, and it is significantly more blunt. And at the very back, you have this part right here, which is called the conoid tubercle. So like I said before, and again, this is going to be a common theme that I'm going to be reiterating a lot, is whenever you have some kind of sharp or prominent aspect to it, some kind of process sticking out, that's going to be pointed either down or away from you. And so in this case, with this, it's going to be pointed away from you. So with the acromial end, you know that that has to articulate with the lateral end of the scapula. So that's going to be either on this side or on this side. So now I know basic, like how to at least orient this a little bit. And then you know that the sternal end is going to be connected to your sternum. So that doesn't really help too much, but there's still very defining features. And so now what you have to refer to is the conoid tubercle, So again, with that having to be pointed down or away from you, this is going to be pointed towards the back, and so you know that this is a left clavicle. Okay, so now we're going to be going over the humerus, which, as I said before, is the bone that's actually articulating with your scapula. And luckily, there's only actually two parts to the humerus that you need to know in order to side the bone, and one of them is the head. So this is the head right here, and as you can imagine, the more rounded end right here is the part that's actually going to be articulating with the scapula. So if you look at the glenoid fossa again on the scapula, you'll notice that it has kind of a rounded depression, and that's actually going to be fitting in perfectly with the head of the humerus. And so now we at least know that this part of the humerus has to be facing medially. So now we have a general orientation. In order to see if it's left or right now, we're going to have to look at the two fossa that are at the distal end. And so right here we have the olecranon fossa, and then right here we have the coronoid fossa. So the olecranon fossa is visually the more deep depression, significantly more deep depression. So I'll bring that in a little bit so you can probably see that. So again, this is the olecranon fossa, and then this is the coronoid fossa. So the olecranon fossa is always going to be pointed posteriorly because the ulna is actually going to be articulating into this groove right here. And we'll get into that later when we're siding the ulna, but just know that the larger depression, the larger fossa, which is the olecranon fossa, is going to be facing posteriorly, while the coronoid fossa will be facing anteriorly. So again, now we'll know that this is actually a left humerus because we have the head facing medially, and then we have the olecranon fossa facing posteriorly, so this is a left humerus. Okay, so now we're going to be getting into the radius. So the radius is another one that's actually pretty easy to side. It's not too bad. There's, again, only really two features that you need to know to figure this out, and one of them is the styloid process. So if you look at the radius, you'll notice that the head up here is kind of small, and then it'll progressively get larger once you get down to the end of the bone. And this part right here is called the styloid process. Kind of, you can think about it as a stylus to like a pen or something. So this is the styloid process, and in anatomical position, that's always going to be facing laterally. And so one common confusion is, well, if I'm looking at my forearm, how do I know which one's my radius and which one's my ulna? And a quick tip for that is you can think of radius and you can think of rad, like putting a thumbs up like rad, you know, one of those old-time kind of like cool things. So yeah, you say rad and rad radius, so you know that your radius is the part that's actually going towards your thumb. And so now that we know that this part has to face laterally, and so I can kind of get a general orientation again. A lot of the times you'll notice that there are, you know, one part of the bone that'll give you a general orientation, but then you're always going to need another part to actually figure it all out. So there's always going to be a couple things that you need to keep in mind when you're siding the bones. The second part to this bone is going to be the radial tuberosity. And I would say that this is the exception to the rule where I said kind of rough or sharp protrusions are going to be facing either down or away from you. This is probably one of the exceptions. So the radial tuberosity is actually going to be articulating with the ulna. Part of the ulna is actually going to rest on this. And so, again, this part's going to actually be facing kind of more up and away from you. So kind of different. So again, now that we know that the styloid process has to be facing laterally, and we know that this part right here, which is the radial tuberosity, has to be facing anteriorly, we know that this is actually a left radius. Let's see if you can see that a little bit better this way. So as you can see, this is facing kind of up and away from me, and the styloid process is still laterally on my thumb. Okay, so now we're going to be going over the ulna, which, as you can imagine, because the radius is the more lateral of the two bones, the ulna is going to be the one that's medial. And so there's only a couple features that we're going to need to pay attention to here. And one of them is the styloid process. So there's the styloid process of the radius, which is on the lateral side in anatomical position. And with the ulna, it's going to be on your medial side, which kind of makes sense. And so, as you can see here, it's basically the exact same shape and same look to it, and that's going to be facing medially. And so now what we need to look at is this part right here, which is the trochlear notch. So the trochlear notch is going to be the part that's kind of wrapping around the end of the humerus. And this part right here is the olecranon process, which is going into the olecranon fossa. And so you at least now know that this has to be facing kind of up. So anteriorly, this notch is going to be facing anteriorly because, let me get the humerus, here's the olecranon fossa, here's the olecranon process, and here's the trochlear notch. And that's going to fit perfectly in here, and that's what's going to cause the rotation at your arm, at your elbow joint. And so now we at least know which part is medial, and then we know which part is facing up. And so now we need to figure out, finally, if it's left or right. And what we're going to use is this little part right here, which is called the radial notch. And it's kind of hard to see. This is, again, one of the bones where I think it would help if you also had one in hand. And so if you look closely, you can look on this side. There's really no notch coming in on this side. But on this side, you have this little depression. So that little depression is going to be actually articulating with the head of the radius. And so that means that in anatomical position, this part has to be facing medially because it needs to articulate with the radius, which is lateral. And so now I can say that this part right here, the styloid process, is going to be medial. This part right here, which is, well, the whole thing right here, which is the trochlear notch olecranon process, that's going to be facing anteriorly. And then this part right here, the radial notch, which has to articulate with the radius, which is more lateral, this part has to be facing laterally in general, in respect to the rest of your body. And so I can say that this is a right ulna. All right, so now we're going to be going over the os coxae, which I think is one of the more fun bones to decide, the more interactive one. So I encourage you, if you can, to have one in your hand right now. So there's a couple features that we're going to need to pay attention to. One of them is the greater sciatic notch, which is right here. We have the lesser sciatic notch and then the greater sciatic notch. We're going to be focusing on the greater sciatic notch. And so what you're going to want to do is put the greater sciatic notch in between your thumb and your index finger on both hands, because this is going to be the first step to siding it. And so once you've done this, you're going to want to put it up to your face, because it's kind of, we're going to be pretending like it's a phone. And so if I put it up to my face here compared to here, it doesn't seem as natural. When I put it up to my face here, it's kind of wrapping around like those old-time flip phones where you have to like kind of fold out the bottom and be able to talk into it. And so you can think of the os coxae kind of as a phone. And this actually right here is called the obturator foramen. And obturator kind of sounds like operator, so it's almost like you're calling the operator. And so at least that's how I like to think of it. And I know my past students have liked that, and it's helped them out a lot. And so once you're holding up your face, you know, this doesn't work. I'm not talking to the obturator. But if I put it on this side, it's wrapping around, and it's like I'm actually talking to a phone. So that's how you know it's a left os coxae. And for those of you who are just curious for a more anatomical approach to it, you can look at this right here, which is called the acetabulum. The acetabulum is going to be the point that your femur is going to be articulating, the head of the femur. And so you know that it has to be facing, this part has to be facing laterally because you know you need your femur to articulate because your leg is on the more lateral athletic part of your body. All right, so now we're going to get to the femur. The femur is one of the easiest bones to side, at least in my opinion, because you only need to know two features to it, and they're very obvious features. So the first feature is going to be the head, which, you know, like the humerus, the head was a little more subtle, but with the femur, it's extremely obvious where that head is. So this is the head of the femur, and this is this ball right here. That's why they call it a ball and socket joint with your hip. It's going to be fitting in perfectly with the os coxae, with the acetabulum of the os coxae. So now we at least know that this part has to be facing medially, so we have a general orientation on our body. And like I said earlier with some of the bones, if you have a sharp or some kind of protrusion coming off the bone, that's usually going to be facing down or away from you, with the exception being the radius. And so this is going to be following that same rule. Back here, if you look at the more anterior side of the femur, you'll notice that it's actually very rounded and very smooth. Whereas if you look at the back of it, the posterior end, you'll notice that it's actually coming to kind of a fine point, and there's this like sharp line that's going down the back of it. And so, following that same rule, that's going to be pointed away from you. And so again, with the femur, the head of the femur facing medially, and this, which is called the linea aspera, the linea aspera is going to be facing posteriorly. We can orient this to say that it's a left femur. Okay, so now we're going to be going over the tibia, which is the larger of the two of like your lower leg bones. So you have the tibia and you have the fibula. So the tibia is the significantly larger bone, and this is going to be the more medial bone. And so there's a couple features that we're going to want to pay attention to. One, this is the head of it, and that's going to be, at the very top of the bone. And then you're going to have the medial malleolus. So this is kind of in the same style as you had the styloid process of the radius and the ulna. So you're going to have the medial malleolus, and as the name goes, it's going to be facing medially. And so this is going to be, on the inside of your leg. So now that we know a general orientation thanks to the medial malleolus right here, we need to figure out if it's left or right. And so this one's a little bit more tricky. The tibia and the fibula cause people a lot of problems because they are a little tricky. There's not too many distinguishing features about them. And so what you're going to want to pay attention to is the back of the tibia. So there's going to be a very rough spot on it, like a physically rough spot, and that's going to be your best indication of whether it's left or right. So if you look at the front here, it's just this kind of sharper protrusion, and this is actually going to be facing anteriorly. Whereas if you look at the back of it, you're going to be having this rough area. I hope the camera picks it up, but if not, you can pick up a tibia yourself and you'll be able to see it right away. So there's a lot more of a rough area right in there, and that rough area is going to be facing posteriorly. So now, with this part facing medially, this part facing posteriorly, the rough part, that's going to indicate that it is a left tibia. Okay, so finally we have the fibula, which is notably one of the harder bones to cite, if not the hardest, because there's nothing that's too distinguishing of a feature to give you a real indication whether it's left or right. So hopefully, we can help you out with that. So there's a couple parts that you're going to want to pay attention to here, and we're going to start with one of the rules that I've been talking about all along, which is if you have like a sharp or rough process, that's going to be facing either down or kind of away from you. You're not going to want it kind of on the outside of your body. And so if we look at the back of this, there's going to be this rough edge right here as long as this sharp point. So that's going to be wanting to face medially in towards the tibia. So if we look at the bottom here now, you'll notice that it's kind of a more fine end. It kind of comes in like it's squished a little bit. And visually, we can compare that to the head, which is kind of expanding more towards the top. And that's going to be a key thing to keep in mind. And so if we look again down here, this is called the lateral malleolus. So again, we have the medial malleolus of the tibia, and now we have the lateral malleolus of the fibula. And so as the name indicates, this is going to be facing laterally. So now, just to finish off the orientation, we're going to look at the top here. So as you'll notice, it kind of raises up a bit right here. So the part that raises up, the highest point of this, is going to always be facing laterally, because if we compare it to the tibia, again, let's side this real quick. We have the medial malleolus, so now we can articulate this with the fibula. You'll notice that it's actually going to fit in quite well with the head of the fibula. And so, again, you might not always have a tibia on hand to where you can compare the two, but now you at least have a good visual as to how they're connecting. And so again, this part is going to be facing laterally, same as the lateral malleolus, and then you're going to have like this rough part right here facing medially, facing inwards. And so hopefully this helped. Again, I think the best way to learn this is if you have one in hand. You just grab a couple of them. You don't know if they're left or right. Just grab a couple of them, do them with one of your partners at the bench, and just try to go through and see if you can figure out if they're left or right. So I hope this was all helpful for you. Thanks for watching. I know this is probably a longer video, but hopefully it'll help you out on your practical and give you some advantages to remember whether the bones are left or right. So thanks for watching.